All right. Welcome, everybody. We are coming to you live from Washington, D.C. And where in Pennsylvania are you, Eric?
York, Pennsylvania.
And York, Pennsylvania, right smack dab in the mid-Atlantic states, D.C. and Pennsylvania. So I'm with my good friend, Dr. Eric Osterberg. And today we're going to be talking about the updates for the East Coast Association Independent Physician Network and its relationship to Secure Care. And you know, if you wouldn't mind, Eric, if you could give us a little bit of background, because you're a pretty accomplished guy. Just give us a little bit of your background, please, in case some of the folks who maybe are not familiar with the ECA IPN or Secure Care or our initiatives together. Tell the audience a little bit about yourself, please.
Sure. Well, I'm a chiropractor up here in Pennsylvania. I've been on the board with the Pennsylvania Chiropractic Association for about the last 10 years. And I got involved with you and all the other folks in the East Coast IPN in Pennsylvania, Maryland, and Virginia about 4 years ago, when we started looking for a better solution to the managed chiropractic networks that were affecting our profession on the East Coast. So this was really an initiative brought together by Maryland, Virginia, and Pennsylvania, and we've been working on it for the last couple of years. My involvement has mostly been outreach to insurance companies and sitting down and explaining our program to insurance companies and talking about creating a better environment for the chiropractors in our area.
And you were also past president of the Pennsylvania Chiropractic Association, were you not?
No, not president. I was vice president for a couple different administrations.
Ah, okay. Vice president. Sounds good. Nobody got impeached like Nixon, so you didn't have to step
No impeaching.
Okay, that's good. That's good to know. Eric, you know, I've been at this now. I was just thinking about it on the ride, here since 2009. So we're coming up on almost 9 years, if my math is correct. And we started this initiative in Maryland and Virginia when I was the insurance chair way back when, because we were just having so many challenges with the insurance companies and access for chiropractic care and fee schedules and all the stuff that's involved in day-to-day activities in a chiropractic office, at least those of us who take insurance. And in Maryland, Virginia, just so you know, we're providing some background and some context, we decided that we needed to look at another solution. We searched the country and we found Secure Care. They've had a 20+ year success rate in Nebraska of helping chiropractors and insurance companies and patients all win by getting rid of fraud and abuse, by really identifying what evidence-based practice looks like, helping to demonstrate chiropractic value proposition to the insurance companies, and then, of course, ensuring that patients have appropriate access to care and doctors are getting paid for the value that they're delivering. So we ended up partnering with Pennsylvania, and then, you know, we formed the East Coast Association Independent Physician Network. And then we, as a group, we decided that we were going to contract with Secure Care to help us acquire some of these relationships with the insurance companies. Now, Eric, since you've been in this initiative since the beginning, maybe you can talk a little bit about what was required of the doctors to join East Coast and Secure Care in the beginning, and how that's evolved through what we've learned over the last several years.
Sure, absolutely. When they started out, there was get into the network. Starting out, there was a $2,000 credentialing fee that all the doctors in all 17 states have paid ever since 1998 or whenever Secure Care began, you know, over the last 20 years. And so a lot of us paid that $2,000 credentialing fee to get involved in the Secure Care network. And that was necessary so that there would be some funding to cover the marketing efforts. But what we found out is that it's just really a challenge to grow the network. And so Secure Care they've adapted over the years, and they've gotten rid of that $2,000 credentialing fee. So any doctors who are joining now, it costs them nothing to join the network. But that creates a situation where some providers who paid to get in think, hey, this might not be fair. I paid a lot and somebody else can get in for free.
Right.
And so we have to find a way to make that right. And the way to do that is, once we have contracts that are up and active and live, we're each going to pay a service fee per CPT code that's billed through the network. And it's small, it's down around the 3% range. But the doctors who paid that $2,000 credentialing fee are going to get a bigger discount on that service fee. So once we have some live contracts, it's all gonna be made right for those of us who jumped in early and invested in this initiative.
I love that you use the word invest, because many doctors look at this as an expense as opposed to an investment, and it is an investment. And those of us who have multi-doctor practices who took care of our fees for our doctors invested a lot more than $2,000, because
right.
we believe that this is a really important thing to do for chiropractic. In fact, what was great in our area, and it probably happened in Pennsylvania too, I can think of numerous doctors who have cash practices. They don't even take insurance, and they decided to join the ECA and Secure Care because they believe so much in the initiative. And those are true chiropractic warriors. And I know you know who you are if you're watching this video right now.
Jay, I can think of quite a few doctors that were, 60 years old, 61, 62 years old, saying, I'm going to be retired in 3 years. This is a 3 to 5 year initiative. And they still chose to jump in, even though this may not benefit them at all.
Yep. We had a couple of those in our area too, which is just great to see. It's just, we got to stick together to make the profession better. What's really interesting is that you and I have you've done the vast majority of the insurance meetings, and I've done a couple with you. You've done an absolutely remarkable job, Eric, and just, you're very well spoken. You're educated on the science. You're educated on the cost data. You're always capable and able to make a very compelling argument to the carriers. So what's been, with the big carriers that we've met with, or that you've met with Lou Anderson, who's the CEO of Secure Care, he's come out several times to help us in this initiative. What has been the barrier? Why haven't we been able to get these contracts?
Well, that's a great question. And this first round of marketing, and by saying that, we are just finishing the first round. It's been a little bit over 2 years, 2 years and 3 months since we've started reaching out to insurance plans. Our first goal was to land one large contract, because it's really which came first, the chicken or the egg. Do we get a contract, or do we build up the provider network? And so our initial hope is, let's get one big contract active, and that will draw all the providers into the network. So that's where we've spent most of our time and most of our effort over the last 2 years. And I got to tell you, the big insurance companies are very open to this conversation. We've met with all of them. I'm not going to mention any names on this video, but we have met with every large payer, every payer that's got more than 500 providers in these 3 states. We've had a chance to sit down and talk to them. They've been very open to it. The challenge is, some of these large payers are already using a third-party administrator from outside of the state. And most of them seem quite content with their third-party administrators. They tell us that they're not getting feedback from doctors. Nobody's complaining about the current programs. They're not getting complaints from patients. And there's plenty of doctors signing up for their current program. And so they don't have a whole lot of motivation to change. We have developed the relationships. We've developed the contacts inside the company. We have reached the point with several of them that I want to say we're very close to having contracts. I mean, we even had the announcement letters written and printed and ready to mail. And then the legal teams got involved and some things fell through at the last minute. So we are still working with these large payers and looking for that opportunity to replace some of the current third-party administrators, and to motivate the companies that aren't using a management service or a management vendor, to try to motivate them that they should take a look at this, because we can bring value to the proposition in a way that is good for patients, good for the insurance company's bottom line, and also good for the doctors as well.
Yeah, I mean, again, Secure Care has a track record, a great track record of demonstrating greater levels of reimbursement over time for the doctors that have participated in the network and done well in terms of, utilization management, just, not over abusing the benefits of the patient. And, once we acquire some of these contracts, I think the doctors are going to be able to see that there is, great value in working with Secure Care to partner with the insurance companies. But we do have opportunities right now, Eric, literally right now, in some of our states with some of the smaller insurance companies.
Yes, we do.
But there's an obstacle that we have, but it can be overcome. So tell us about that.
All right. So after we went to all the large companies first, we next turned our attention to the small companies. Now, the smaller companies, their challenge is getting enough providers to sign up, because providers aren't as motivated to go join the smaller companies. But that's where we're going to have to go next. Our challenge with Secure Care, we can provide the cost savings, we can provide the services that these companies are looking for, but we don't have enough providers. there's only 5, 6, maybe 7% of us have joined into this initiative in our 3 states. We don't have enough. All of these small companies have Medicare and Medicaid programs. They have geodensity requirements. They have to have a certain number of doctors, whether it's within 20-minute drive of a particular location or whether it's within a 20-mile range. They have a certain number of provider requirements, and we don't meet those at this time. We haven't had enough doctors join. So for our second wave of marketing to insurance companies, we need doctors to join Secure Care. If they haven't gotten involved, the 94% of the doctors that haven't joined us in this effort, now's the time to sign up.
And what's fascinating is we have over 500 doctors that are in the network, and yet that's still not enough.
No, it's not.
Substantially more, because there are geographic pockets where there's nobody.
That's right. That's right. We've got about 550 doctors who've signed up across Pennsylvania, Maryland, Virginia, but we're pretty well spread out across that area. And there are areas where there are counties where we don't have anybody.
Yeah. And so the opportunity exists for us to get these contracts. And because that opportunity exists, again, Secure Care has pivoted and made some policy changes. There are 2 really important ones. Just remind the audience, what those 2 things are, that those obstacles or perceived obstacles in the way previously.
Well, sure. The biggest issue is probably when it comes to clearinghouses. There were some doctors that, we partner with Infinity, and they're the technology partner. And doctors initially, some of them had an EHR billing program that wasn't compatible with Infinity. And so they wanted to join, but they weren't able to. And so Secure Care and Infinity have worked out a way to transfer the data so that that's not an issue, that they don't have to join up. They don't have to sign up with Infinity as well as Secure Care. They can just sign up with Secure Care.
And then the second element, which we talked about earlier, was now there's no fee to join. There's literally no risk for the doctor to join the network. They don't have to change clearinghouses, right? And they don't have to spend the money and make the investment. Just as an FYI, I'm an Infinity user. I love the clearinghouse. They've done great work for us. But at the end of the day, if somebody doesn't want to switch, they don't have to now. Exactly. So there really is no reason, especially in those geographic areas that we need, for doctors not to join. How can they find out about what geographic areas are in the greatest need right now, Eric?
Probably the best way is to contact me. But honestly, we want to cover all of Pennsylvania, Maryland, and Virginia. So if you're involved with the associations, Pennsylvania, Maryland, and Virginia, if you're practicing in the states, just go to the Secure Care website and click the button, fill out your information. It'll take you 2 or 3 minutes. They'll send you a packet. They'll work with you and get you hooked up. It isn't going to take anything but your time.
Yeah, it's securecarecorp.com, correct?
Securecarecorp.com.
And because we address the insurance companies in a compliant manner, we also know that doctors, when sent an insurance contract, they have the ability to turn it down. They've got the ability to deny the terms of the contract.
Absolutely.
Just because they've been credentialed with Secure Care.
Absolutely. And really, it's completely transparent. With the messenger model that we're using, it's not like you've got a short window each year to choose if you want to opt in or opt out. You can join into a contract. If you don't like it, you click a button and you're opted back out. And so you have complete control at what level you want to participate once you join.
That's great. Eric, 2 last questions for you. The first one is, what do you say to a doctor who comes up to you at a state association meeting or calls you on the phone and is like, dude, come on, man, it's been 2 years, and they've become Secure Care members, right? They invested, or maybe they didn't invest and they just signed up recently. Hey, man, it's been a while. What's the scoop? Is this ever going to happen? We're laughing because we hear this all the time and we answer these questions all the time. But what do you tell those folks?
We do. Look, I understand that there are some doctors that are getting frustrated because it's taken time.
I do too.
It's taken a lot of time. But the answer is, if you don't get involved with us, it's never going to happen. We're here to change the environment for chiropractic. We've been working under the thumb of some out-of-state companies that are making our practice environment really, really tough and less than ideal for our patients as well. If we're going to make a positive change, we all have to work together. And so we got a much better chance of making some good changes if you get involved with us.
Yeah, I think I tell those people typically patience is a virtue. I've been at this for 9 years. And anybody who has done anything worthwhile in life knows that you have to have persistence. You have to have grit. And, you know, when things get tough, you just can't give up. You just have to have the notion that we're on the right track. This is a good initiative. It's an important initiative, and we've got to stick to it. Now, what do you tell the doctor that comes up to you who's not involved at all, who's never done anything with secure care, when they're like, Eric, why should I join?
Well, you should join because we have the ability to make a positive change. Yes, it's taking time. Yes, it's slow. We're here to replace third-party administrators from outside of the state. Those companies are typically working on 3-year contracts. So every 3 years, they consider new options when they review what they're currently doing. So every couple years, we get the opportunity, but the more doctors we have in the network, the better the chance we have of making that happen. And
Amen.
Just one decision by one insurance company can make a huge difference. Secure Care is making those changes in other states, and they're finding opportunities over here and over there and down there. And they're seeing some amazing things where suddenly the insurance companies aren't pigeonholing everybody into an acute care model. They're allowed to treat chronic conditions. They're not limited by the time frame on the length of the care. The doctors and patients get to make all the decisions about medical necessity and what these patients need to get. And something else we're seeing is that the value is demonstrated of the chiropractic care, and the insurance companies are starting to increase reimbursement rates all across the country where Secure Care is working with them because they see the value in the care that's being delivered.
Yeah, we know in at least 2 states, right, that the reimbursement went up in Nebraska and Minnesota, correct?
The reimbursement's going up in every state Secure Care functions. But yes, Nebraska and Minnesota, we've seen that in the last year.
That's phenomenal. I know it's hard to believe, but it's the truth. So that's a beautiful thing. Their track record is there. I just want to leave the audience with one last thing, and Eric, I'll get your last comments. But you know, it's really interesting. I went to Secure Care's board meeting. They had a strategic planning meeting a couple months back, and I had the opportunity. I'm not on the board. I'm just there as part of the advisory committee from the expansion states. And myself and Dr. Nicholas Payne had the opportunity to sit in on that meeting and just listen to these guys. And it had been a while since I'd been to Nebraska and met with the Secure Care Board and Nebraska Chiropractic Physicians Association Board. But I will tell you, they are really good people. I was just as impressed with them as the first day that I met them. Their commitment to chiropractic is true. It's honest, it's transparent, and they're really working hard to try and make chiropractic and chiropractic practice better. And I just want the audience to know that, because I know we don't communicate enough. There's never enough time to communicate all the things that are going on and all the things that we're working on. But I just want everybody to know that this is a really good group of people that are conscientious and care about chiropractic, and we are their extenders. We are there working, trying to keep this initiative growing. And it's going to take time, but ultimately we will get there. So those are kind of my last comments. Eric, I would love to hear yours.
I don't think I could have said any better than that. Maybe I'll remind people this is an initiative that's brought on by the state associations in Maryland, Virginia, and Pennsylvania. It was a unanimous decision by the board members, at least in Pennsylvania. I was there. There are 22 people in the room. It was unanimous that the state association is behind this effort. So there's new people coming into this now with questions who haven't been involved in what we've been doing the last few years, that just kind of wonder who we are and what makes us different. Reach out to us, talk to your state association's board, because they're all involved in this and they're all behind it. Call the president of your state association and discuss Secure Care and find out what you can do to help out with this effort.
Awesome.
We're here to help.
Eric. Hey, before we go, I got a couple things I got to do really quick. So hold on, I'm gonna put my earbuds down 1 second. So hold on. I'm an equal opportunity holiday celebrator. So I got my ugly Hanukkah sweater going on. You guys like that? And then I got my Santa hat. And anybody else who celebrates any other holiday, I just want to wish everybody a very happy holidays. Here's to you. And Eric, thank you so much for all you do.
Thanks, Jay. Appreciate the opportunity to talk with you today.
Peace.
Have a great day.